Welcome to another insightful episode of Healing Horizons, the podcast where we delve into the transformative world of alternative therapies. I'm your host, Liam, and today we're embarking on a profound exploration into the realm of dual diagnosis, the intersection of addiction and depression, and how Ibogaine therapy is shedding new light on these complex challenges. I am thrilled to welcome today's guest, a renowned expert in the field of Ibogaine therapy, who has dedicated years to researching and implementing this innovative treatment. Let's dive in. To get us started, could you provide a definition of what a dual diagnosis entails and why it is such a prevalent issue among individuals struggling with addiction and depression?
Certainly. Dual diagnosis refers to the condition where an individual is afflicted with both a mental health disorder and a substance use disorder. This combination is complex, as each condition can exacerbate the symptoms of the other, creating a challenging cycle for individuals to break. It's more common than many people realize, with studies suggesting that nearly half of those experiencing addiction also have a co-occurring mental health issue, such as depression. The link between these conditions is often rooted in shared risk factors like trauma, genetics, and environmental stressors, which makes treatment particularly challenging and calls for an integrative approach.
That really paints a picture of the complexity involved with dual diagnosis cases. It's clear that a nuanced approach to treatment is essential. Speaking of treatment, let's delve into Ibogaine therapy. Can you share its origins and its traditional uses in healing?
Ibogaine is derived from the root bark of the Tabernanthe iboga plant, which is native to the rainforests of Central Africa, particularly in Gabon. Traditionally, Ibogaine has been used for centuries in spiritual rituals and healing ceremonies by the Bwiti tribe. These ceremonies often involve extensive preparation and are aimed at personal introspection, spiritual discovery, and healing. The transition from these traditional practices to modern-day therapeutic uses is quite fascinating. Over the past several decades, Ibogaine has gained attention for its potential to interrupt addiction by resetting the neurotransmitter pathways in the brain affected by substance dependence.
It's incredible how a substance with such deep traditional roots has found a place in modern therapeutic practices. Now, shifting to the technical side, can you explain the neuroscience behind how Ibogaine interacts with the brain to address addiction and mood disorders?
Ibogaine acts on multiple neurotransmitter systems in the brain, which is what makes it such an intriguing option for treating dual diagnosis. It primarily affects the dopamine system, which plays a significant role in addiction. By resetting the dopamine receptors, Ibogaine can help diminish cravings and withdrawal symptoms, a critical advantage for those trying to break free from substance dependence. Additionally, it interacts with serotonin and NMDA receptors, which are linked to mood regulation and neuroplasticity. This interaction can provide relief from depressive symptoms and foster a sense of well-being. The process is complex and involves a holistic recalibration of the brain's chemistry that supports both the cessation of substance use and the improvement of mood disorders.
Thank you for that comprehensive explanation. It's fascinating to see how Ibogaine touches so many different aspects of brain chemistry, offering such holistic potential for dual diagnosis treatment. Can you share some personal stories or cases you've encountered where individuals have undergone Ibogaine therapy to overcome dual diagnosis challenges?
Absolutely. One story that stands out involves a young woman in her 20s who came to us with a long history of opioid addiction and severe depression stemming from personal trauma. Like many, her conditions were deeply intertwined. Her drug use exacerbated her depression, and her depression fueled her drug use. After undergoing Ibogaine therapy, she reported a profound reduction in cravings and an improved outlook on life. Post-treatment, with the support of a structured aftercare program, she has remained drug-free and has made significant strides in her mental health journey. Stories like hers remind us of the power of integrative treatments, and though each experience is unique, the common thread is the transformative potential that Ibogaine therapy offers when combined with a strong support system.
What a powerful and inspiring story. It really emphasizes how crucial a comprehensive treatment approach is and the role of supportive environments in recovery. With that in mind, what are some of the safety considerations associated with Ibogaine therapy, and how can they be managed to enhance outcomes?
Ibogaine therapy, while offering significant potential, must be approached with caution. There are inherent risks, primarily related to its impact on the electrical system of the heart. Therefore, patients should undergo thorough medical screenings, including cardiac evaluations before treatment. The procedure should be administered in a medically supervised setting with healthcare professionals who can monitor and manage any adverse reactions. Moreover, potential side effects such as ataxia, nausea, and fatigue are meticulously managed through pre-treatment planning and careful monitoring. The importance of pre- and post-treatment care cannot be overstated. It ensures the safety of the patient and maximizes the efficacy of the therapy.
Safety is indeed paramount when dealing with such potent treatments. It's reassuring to hear that there are structured protocols to enhance patient safety and effectiveness. To wrap up our discussion, how important would you say it is for individuals experiencing dual diagnosis to explore alternative treatment options? And what advice would you offer to anyone considering Ibogaine therapy?
Exploring alternative treatments like Ibogaine is crucial for individuals with dual diagnosis who have not found success with traditional therapies alone. These individuals often face complex, intertwined challenges that require innovative approaches. My advice for anyone considering Ibogaine therapy is to do thorough research, consult with professionals in the field, and ensure that the treatment is conducted in a reputable, medically supervised setting. Additionally, combining the treatment with comprehensive aftercare that includes therapeutic support and lifestyle adjustments significantly enhances the prospects for long-term recovery. It's important for individuals to know that they are not alone in their struggles, and there are compassionate communities and resources available to support their journey toward healing.
Thank you for those insightful recommendations. It's clear that Ibogaine therapy, when applied judiciously, offers a beacon of hope for those grappling with the complexities of dual diagnosis. As we come to the end of this episode, I want to extend my deepest gratitude to our expert for shedding light on the intricacies of dual diagnosis and the transformative role Ibogaine therapy can play in recovery. For our listeners, we hope today's discussion has inspired you, offered new insights, and perhaps illuminated a path forward you hadn't considered before. Remember, healing is a journey, and exploring new horizons can open doors to unexpected potentials. Thank you all for tuning in to Healing Horizons, and we look forward to welcoming you back for our next episode, where we'll continue to explore the myriad ways in which alternative therapies can foster recovery and transformation. If you like this episode, please leave us some feedback. Until then, take care of yourselves and each other.